You may ask, why do I need to be treated with radioactive iodine at all if my prognosis is so good? This question leads us to a discussion of the benefits of treatment of thyroid cancer with radioactive iodine. You might remember in the initial graphic showing a thyroid cell with receptors on its membrane, thyroid cells rely on iodine receptors to bring iodine into them, enabling them to make thyroid hormone. Because of this, if we substitute radioactive iodine for the iodine that is in your diet, the cells that take up the radioactive iodine can be eliminated by the radiation. Radioactive iodine can be thought of as a targeted approach for treating some thyroid diseases, including thyroid cancer, because of this propensity of thyroid cells to extract and concentrate the radioactive iodine administered to you. There are two main benefits to individuals with thyroid cancer when they are given radioactive iodine after surgery to remove the thyroid gland. The first benefit relates to the completeness of thyroid surgery. When the surgeon removes the thyroid gland, it is often difficult to remove the entire gland. This is because there are other important structures that are either very close to or perhaps even within a portion of the gland. One of the structures is a nerve that leads to the voice box or vocal cords. Accidentally cutting this nerve can cause permanent vocal cord paralysis, hoarseness, or worse yet, might lead to a tracheostomy. We utilize radioactive iodine in destroying residual normal thyroid tissue that was not removed during surgery. It is important to destroy any residual normal thyroid cells that were not removed by the surgeon to facilitate the long-term detection of recurrent thyroid cancer. This is done by analyzing the blood for the protein thyroglobulin. As you may remember, normal thyroid cells use a protein called thyroglobulin to make thyroid hormone. Some of the thyroglobulin leaks out of the thyroid cells normally and can be measured in the blood. Thyroid cancer cells also make thyroglobulin. Thus, it is necessary to eliminate thyroglobulin made by any remaining normal thyroid cells in order to detect thyroglobulin that is made by recurrent thyroid cancer cells. The second benefit comes from eliminating any residual cancer cells not removed at surgery. Eliminating these cells can decrease the chance that the thyroid cancer will reoccur at the site of the initial cancer, decrease mortality caused by thyroid cancer, and decrease the risk that the thyroid cancer will spread to other organs such as the lungs and bones. Radioactive iodine is also used to treat patients when the thyroid cancer has spread to distant organs such as the lungs. With respect to the radioactive iodine, it is of course your choice whether or not to proceed with this treatment. Now that we've discussed the benefits, let's talk about the potential risks of treatment with radioactive iodine. The first category of risks results from radiation-induced damage to our genes, potentially causing other cancers to occur later in life or mutations in the DNA of eggs and sperm. The chances of this type of gene damage occurring to a treated patient are very small, though increase with the dose of radioactive iodine. However, even a small dose of radioactive iodine could cause this effect. The precise risk of developing a second cancer resulting from treatment of thyroid cancer patients with radioactive iodine is difficult to calculate. Combined data from two large studies showed that patients treated with radioactive iodine had a slightly increased risk of developing secondary cancers after treatment with radioactive iodine. There have been reports of treated patients developing carcinoma of the stomach, bladder, colon, salivary glands, melanoma, and leukemia. On the other hand, the remaining side effects increase in severity and frequency with increasing doses, including neck pain and swelling can occur. But significant pain is uncommon, and it is more likely when there is a lot of thyroid tissue left in the neck following surgery. Small painful mouth sores can occur. These can be located anywhere along the lining of the GI tract. In the mouth, these might be prevented by frequent gentle brushing of the entire mouth, including the roof of the mouth and tongue, with a soft toothbrush every 3 or 4 hours for the first several days. Radioactive iodine treatment can cause a decrease in sperm counts in males, and permanent infertility in males is rare. We recommend that treated men delay any attempt to produce a pregnancy for a period of 3 to 4 months. Radioactive iodine may decrease ovarian function in women. The menstrual cycle may temporarily stop for up to 4 months. We recommend that women delay pregnancy for at least 6 months following therapy. The salivary glands can become inflamed following treatment. Many patients experience a decrease in saliva that can be temporary or permanent. This can result in a dry mouth, which could lead to dental cavities and salivary gland duct stones. Staying hydrated by drinking 3 to 4 liters of water a day following treatment may be helpful in avoiding these problems. Additionally, sucking on hard candies such as lemon drops causes salivation and is thought to be protective when started a few hours after treatment with radioactive iodine and continued for a few days. Following treatment, some patients occasionally experience nausea and vomiting. Anti-nausea drugs can prevent this from occurring. The sense of taste can be altered temporarily or even permanently. Food may taste metallic or salty. Damage to the tear-producing glands or tear ducts can result in either the decreased production of tears, dry eyes, or excessive tearing. A decrease in white blood cell count and platelet counts can occur for up to 6 to 10 weeks, which could cause an increase in your susceptibility to infection or bleeding. This is a rare side effect and seen only with very high doses. Sometimes the radioactive iodine treatment that you receive may not be effective in preventing reoccurrence or spread of thyroid cancer. Uncommonly, additional treatments may be necessary in the future. In summary of the side effects, many of our patients notice few or no symptoms following treatment with radioactive iodine. If they notice anything, they might sense that things taste funny for a while after treatment.